to this week's edition of NHIS in a Week. In the headlines, NHI welcomes new CEO Dr. Dacosta Abuaje. New NHIS CEO Dr. Dacosta Abuaje outdoors vision. Uganda Committee on Gender, Labour and Social Development visits NHIA. And NHIA participates in its first quarter subcommittee on case management. Now to our first story. The National Health Insurance Authority welcomes its new Chief Executive, Dr. Dacosta Abuaje, following the appointment of Dr. Bernard Okoboy as the Health Minister Designate. Dr. Isaac Noble Morrison, leader of the transition team, expressed commitment to a smooth transition, emphasizing that Dr. Abuaje's extensive experience in the health sector, coupled with the support of the board and management, will make his tenure a productive one. The new NHI boss, Dr. Abuaje, in his opening remarks, pledged to contribute significantly to the NHI's growth, promising an open-minded and professional approach to enhance the scheme. He encouraged staff to share ideas to drive his vision for the authority.
I studied the National Health Insurance Scheme at a PhD level. When I was collecting my data, I was young, Dr. Morrison was still here, so I was happy to see him at the board, as member of the board. But the young will also grow. Through counseling, taking advice, today I'm the CEO. Yes, I have my vision. I may do things differently, but may not change what is already happening. I hear my predecessor came with 5 of these. Okay. You know, my master's was also within the public health space, promotion, prevention. I believe that no healthcare system will survive if we do not stand on the principles of the Ottawa Charter, dwelling on promotion, prevention. So I've presented this to Parliament, and I have some allocation to champion my vision. Whilst I was in the Health Promotion Division of the Ghana Health Service, we started something called the Health Promotion and Prevention Benefit Package. Now, it is being supported by the USA. Promotion prevention normally takes a long time, but the overall effect is reduction in disease burden, cost burden, and a lot of economic benefits.
Now, an 11-member delegation from the Ugandan Parliament's Committee on Gender, Labour and Social Development visited the National Health Insurance Authority as part of their 4-day study tour of Ghana, led by Honorable Kabihanda Lavia. The delegation aimed to learn from Ghana's health insurance policies and operations, especially regarding the nation's efforts at attaining universal health coverage. They commended Ghana's progress in making healthcare accessible, particularly for women, children, and the aged, through the National Health Insurance Scheme. Mr. Raymond Abenu, the Acting Director of Administration at the head office, thanked the delegation for choosing Ghana for their study tour and encouraged them to take advantage of executive training programs at the Kofi NHIS Learning Center, stationed at the University of Ghana, to deepen their understanding of the scheme's operations. Moving on, the NHI conducted a sensitization session for staff in the Western North region on the new grade structure of the authority. Over 65 staff from various districts and regional offices were briefed on the structure launched in 2020 and tasked with disseminating the information within their respective offices. Mr. Dixon Nukudansu, the Deputy Director in charge of Training and Development, explained that the training is aimed at addressing distortions identified after the virtual training of 2020. During the COVID pandemic, he clarified staff progression and dispelled the perception that promotions were not occurring. He re-echoed the reward schemes implemented by the authority since 2012, adding that the latest grade structure clearly defines staff progression. Still in the bulletin, The authority held a 2-day membership performance review meeting for regional directors and staff. The meeting aimed to assess performance in 2023 and discuss goals for 2024. During the sessions, the acting director of membership and regional operations presented an overview of 2023 membership reaching 17.8 million, representing 55.5% of the population, and a target of 20.7 million for 2024. Regional representative expressed appreciation for the logistical support received and requested more resources. The meeting was seen as productive and motivating staff for the year ahead. The NHIS embarked on a 2-month enrollment drive targeting corporate bodies, including the management and staff of the Ghana Revenue Authority, from March to the end of April. This initiative covers employees from various GRA offices in Accra, such as the head office at Kimbu, Customs Headquarters, Heritage Towers, and 25 other offices across the capital. The goal of this registration campaign is to raise awareness among Ghanaians about the NHIS benefit package, benefits list, and the newly introduced My NHIS app, aiming to boost NHIS active membership and work towards achieving universal health coverage by 2030. Now to our final story. The Single Window Citizens Engagement Services (SWCES) of the Ministry of Gender, Children and Social Protection has organized a 2-day workshop for its first quarter subcommittee on case management meeting. The meeting aimed at discussing overdue cases as of 26th February 2024 and took place from Thursday 7th to Friday 8th March 2024 in the Eastern region. It sought to share case management activities or strategies of SWCES and Social Protection Program and updated members on the SWCES IE and C materials. The subcommittee on case management of the SP Intersectorial Technical Committee, after its inauguration in 2022, has worked effectively and efficiently in delivering the mandate of SWCES to bring together the heads of major social protection programs and some referral institutions to strengthen and improve the case management processes of SWCES. The NHIS was represented by the Director of Corporate Affairs, Mr. Oswald Isuya-Mensah.
Hey, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for interns. But no shaking. I have NHIS already.
After you're on a line, ting.
Ina, look at you. What are you going to do in the office when you can just download their app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Miss Steph, I'm starting work next month.
Now, this is how we wrap up this week's edition of NHIS in the Week. For more stories, do log on to our website www.nhis.gov.gh or follow us on all our social media platforms. My name is Angela Sieg. Thanks for watching.